Welcome to this session where we talk about not just what's going wrong, but what's also going very, very right, and how nurses are participating in leading this effort. If you're not a nurse, you are so welcome to join us and hopefully take away things that you can use in your own profession, or you might want to become a nurse at the end of the time. This session is co-sponsored by the School of Nursing at the University of Wisconsin at Madison and the School of Nursing at the University of Minnesota. And we're grateful for their support, especially with technology and registration.
Hi, everyone. This is Jessica Leclaire. My pronouns are she, her, hers, and I'm an instructor with the University of Wisconsin-Madison School of Nursing, which is located in the land of the Ho-Chunk Nation, which they've called Dejope from time immemorial. And I just want to echo Teddy's welcome to everyone. I'm so thrilled that you're all here and joining us in this movement for planetary health nursing. We want to do a quick shout out to our student leaders who are assisting us today. It's their passion for the intersection of environment, nursing, and planetary health. They keep me going. And I'm just constantly deeply inspired by all that they do. So we really appreciate you, Rachel, Lori, Maria, and Lois. Thank you so much for your assistance today. Do next slide, please.
So as a way of introducing ourselves, we're each going to share a little bit about us, those of us that are speakers, and answer the question, what keeps us up at night? So I saw Beth join us. Beth, are you on?
I am. Hello, everyone. Would you like me to go first?
You go first. That'd be great.
What keeps me up at night? Well, clearly I'm deeply engaged with our socio-environmental crisis that we are all talking about today. You know, taking it lightly for a moment, I think of it some days as a plot-rich novel, and I wonder very much what's going to happen. I don't know yet. We can't see around that corner yet. You know, it's very much up in the air as to whether we will keep ourselves out of the worst danger or really go right into that. So right now, especially in this next decade, which seems so pivotal, that really does keep me up at night. I say often, what on earth is going to happen? I've often said by mid-century, I think, and I'll be alive if all goes well, I'll still be alive by then, we'll have a pretty good idea. But I live in this sort of time of suspense all the time about this because I'm so interested and curious about that. Now, there are darker moments to that about you know, all the work that needs to be done and all the work that I'm doing, as are all of you. But in a certain sense, that kind of captures it for me. Is we're at a critical and pivotal point in time, and what will we collectively do together?
Great, thank you, Beth. And if you could just say what your role is at Providence, that would be wonderful.
Thank you. Yes, I'm the Executive Director of Environmental Stewardship for a large health system. It's the third largest health system in the United States in 7 Western states. And we have made the boldest climate commitment in US healthcare, and that is to become carbon negative by 2030. Thank you.
Thank you. And Katie?
Hi, everyone. So excited to see so many people here today. I'm Katie Huffling. I'm the Executive Director for the Alliance of Nurses for Healthy Environments, and I'm also a nurse midwife. And I would echo a lot of what Beth said, but I would also say that one of the things that keeps me up at night on a more positive note is just my mind will just start spinning with all of the amazing things that I think nurses can do. There's so many opportunities to improve health planet-wide. It just like where to even begin, and that I think just that excitement of all the possibilities is what keeps me up.
Thank you. Shanda.
Everybody, Shanda, practice green challenge. And
you're kind of cutting in and out. Is there a way to
up at night? I'm not sure. Is it still kind of shaky?
That's better.
Okay. So what keeps me up at night? I just turned 30 a few months ago, It's a really interesting time to be a young adult, I think, during this planetary and climate crisis, because many of us are facing these decisions of whether or not to decide to have children and what that means for future generations. And that's at the front of my mind a lot. So we will talk more about all things hopeful, but I think it's important to be honest about these things that are really scary as well.
Great, thank you. Oriana.
Hi, everybody. Good evening and good afternoon for those of you, depending on where you're at. My name is Oriana Bodet, and I am the Vice President of Innovation at the American Nurses Association. And I would say that the thing that keeps me up at night is trying to figure out how we can mobilize nurses at a national and global level, which fits in perfectly to the work that we're going to be discussing this evening with everyone. So thank you for joining.
Thank you very much. And Jess, we learned who you are, but we didn't learn what keeps you up at night.
Yeah, thanks, Teddy. Well, as you know, my background is in public health nursing, and after witnessing the health effects of climate change disproportionately affecting young children in low-income communities of color in Madison, Wisconsin for over a decade, I just felt there were very few resources at the time for public health nurses to effectively make a difference. And these concerns literally kept me up at night. And that was before I found my way to the Alliance of Nurses for Healthy Environments. And now Planetary Health inspires my nursing brain because it is this holistic framework that describes how climate change is only one downstream symptom of this multi-system failure within our planetary body. And the more I understand the full picture of what is before me, the more clarity I have of what's needed to help the healing process. So I think I would concur with some of my colleagues here that now I'm kept up at night in a good way for what we can do to move forward. So how about you, Teddy?
And I will add to the continued thread of hope. What keeps me up at night is innovation and thinking about ways to solve the problems before us and to unite people across the globe and to empower a hopeful movement. And I am absolutely convinced that the world needs nurses more than ever at this point in time, because we are systems thinkers and we really understand how to use relationships to leverage solutions. So now it's your turn to help us understand who you are and who's in our circle. And so Shanda's going to help set up some breakouts for that.
Okay, as people are weaving their way back in, we would love for you to share a couple themes via chat that you heard from others during the breakout session about what keeps folks up at night and what some of that inspiration is for planetary health. So fire away into the chat. And I was in breakout 8 with Teresa from the University of Nevada, and she shared about how when she started this work, it was very challenging for folks to understand how there's a space for nursing in this. I see influencing students by teaching them. Keep it coming. Future generations. Thank you, Janet. Thank you, Lindsay. Molly shares what keeps them up at night. Let's get a few more chats before we, yes, exactly. Agriculture. Thank you, Rachel. Holistic care, community health needs. Thank you, Jessica. Future nursing workforce, children's mental health, absolutely. Toxins. Many of the things you've shared, we will all spend time talking about in our little sessions together. And do feel free to keep these chats coming. What is keeping you up at night? This is the safe community to share that. What's inspirational to you? This is the community that wants to hear that. So with that, Teddy, I will pause and I'm happy to hand it back to you to get us going.
Great. And now we're going to start off with some wonderful examples of what nurses are doing. And we lead off with Beth Shank talking about research.
Thank you very much. I'm happy to talk about this today. I'm sorry, I'm getting my pens working. They don't work there, so I can take some notes. There is a lot of work going on around the world with research related to environmental health in nursing and in climate change in nursing. I am a part-time researcher, but I've had the privilege of interviewing researchers for the Nurses for Healthy Environments podcast. So I've talked over the past 4 years with dozens of nurse scientists who are studying things from exposures to pharmaceuticals, to indoor air quality, to climate change adoption and advocacy. And it's inspiring and growing, I would say. So I hope all of you will be able to pay attention to researchers in the field, nursing researchers who are either working on the profession of nursing or working on the basics of health as the environment affects health. There's a little bit of theorizing out there about planetary health from nursing viewpoints, and that's also really interesting to read about and listen to. But I'm going to take a few moments to talk a little bit about my areas of nursing research. And so if we'd go to the next slide, please. One piece of my work is the development of the Nurses Environmental Awareness Tool. Now, this is focused on acute care practice, which in the United States, or at least in the United States and Canada. And this is because I wondered how much nurses knew about the polluting aspects of healthcare, and healthcare is substantially polluting. And so I wanted to ask and begin to move the dial based on what I learned from awareness of these of pollutants, how related they thought they were to health, what they did about it at work, and how easy or difficult that was, what they did about it at home, and how easy or difficult. And then how do these things relate? If people are doing more at home, are they doing more at work? If people are more concerned about the health impacts, does that mean they're more aware of it? So this has been quite interesting. I just reported out, let's see, it was 2 weeks ago, on a study of 2,500 respondents to this survey. And it's just quite interesting. And it also provides a method for people to use a before and after examination. So I compared results 6 years apart in the same hospitals, same 7 hospitals in the Western United States, in California, Washington, and Oregon, and found that awareness was higher. Action was really not very much higher. And in both cases, nurses ranked that it was easier to do, I called them pro-environment behaviors at work than it was at home. That was surprising to me. So there's a lot more to understand about that as time goes on. Next slide, please. Another scale that I have been involved with and have led the work of, but I have co-authors and co-investigators, including Dr. Shanda Demarest on the call here, is the CHANT, Climate Health and Nursing Tool. So this was designed because of a gap in knowledge about, well, what do nurses even know about climate change? How aware are they? And what are they doing about it? And what motivates them or demotivates them to act? So this is intended to be used over time, to watch change over time. And we developed it in 2017, tested it in 2018, and it's been in use ever since. In 2020, we expanded this beyond nursing, so it's available to all health professionals. So any of you who are working in this field, just put your camera up to this QR code and it'll take you to the survey. And it will also, you can find out how to use this yourselves as researchers if you would like. To date, it's been used in over 30 nations. It's in 3 languages now and also being translated to Finnish and Korean as we speak. So what are we finding? We're finding that really of the nurses we have surveyed, there's a high level of awareness. So awareness is not the issue so much about climate and health. Their reasons to act are, as you might expect, they're concerned about their family, they're concerned about the planet itself, concerns about health, concerns about future generations. Reasons they don't act are, the biggest one always is, it is too complex. Oh no, I'm sorry, I'm overwhelmed. I am overwhelmed, with another close runner being, it's too complex and I don't know what to do. So we can help with that. Those of us who are not overwhelmed by this, or I should say, can help people not be so overwhelmed, can encourage our colleagues and peers to address this. A troubling response that we found really in each circumstance that we've tested it has to do with advocacy. So when we ask the respondents how often they talk with their peers versus their family and friends versus their professional peers versus talking with their elected officials. They talk with their friends and family pretty frequently. This was the most common answer. With their peers, some, a few times a year, maybe monthly. And with their elected officials, 60% said never, and another 20% said rarely. So this is a place where we can actually work. We can push on our profession and other healthcare professions to speak out more, because this is really fundamentally about health, about climate and health, and in the end, about planetary health. Next slide, please. Another area that I have found particularly interesting, and this is again acute care focused, but we have what we call nurse sensitive quality indicators, and you all may know that it's certain outcomes that we think that are determined to be more impacted by nursing, like falling, pressure ulcers, urinary tract infection, and bloodstream infection. So the idea here is that maybe there are some nurse sensitive environmental indicators. What is it in terms of environmental stewardship in healthcare do nurses have more access to and have more power over to control? So a colleague of mine, Sarah Johnson, and I are taking the We Act framework, which I'm not talking about today. That's another thing that I've developed, and asking leaders across the country, nurses for the most part, or people who work with nursing on environmental stewardship, about what nurses have proximity to, what they can affect. And we're analyzing these results now, but it's interesting. And we know already that waste is one that comes up very quickly and early. And nurses do have a lot of opportunity to impact waste. A lot of what goes of the products in healthcare go through our fingers. We have a little less influence on energy. We don't install solar systems. We have some influence on food, ag and food, by supporting healthy foods, local foods, but we're not the nutritionists. We're not the buyers of food. Chemicals is another place where we have quite a bit of influence. So reducing the chemicals we're exposed to and protecting ourselves properly, that's a place that so far we're learning nurses have a lot of access to. Transportation is kind of generally available to all caregivers, not specifically nursing. So this is interesting to me because I'm always wanting to understand, where can nurses push? Where is it more difficult for nurses to push? Next slide, please. And this is just my last slide to mention to you all, in case you have not listened to the Nurses for Healthy Environments podcast, this is kind of a pitch so that you just will be aware of this. And I'm always looking for nurses who are working at the intersection of health and environment to interview. So if you are one of those, please let me know. And this is where you can find it on the Alliance of Nurses for Healthy Environments website. Thank you very much, Teddy.
Thank you, Beth. And these podcasts are wonderful, and they're a great way for us to disseminate to other nurses and to patients and communities what nurses are busy doing. So I really would urge you to take a look at those, or listen to those, I guess. The next person is Shanda Demarest.
Thanks, Teddy. Back to me. All right, so I am eager to join you all to talk about another initiative called the Nurses Climate Challenge. Let's go to the next slide. So during my time as an assistant clinical faculty member at the University of Minnesota, actually, I was working on trying to develop my scholarship as a brand new faculty member. And I was aware of the terrific work that ANNE, Alliance of Nurses for Healthy Environments, was up to. I was also distantly aware of some of the efforts that Healthcare Without Harm was working on, and that they are an international nonprofit all about environmental sustainability and climate resilience within healthcare. And so I really cold reached out to these organizations and said, is there any space to develop a nursing campaign around climate and health education? And that is where the Nurses Climate Challenge was born. And so over the course of several months, we pulled together a working group and built this campaign really from scratch about reaching 50,000 nurses and other health professionals with content about how climate change is impacting patient health and community health. And this is really a grassroots effort. And we know that we want nurses to take action on climate, but this started around 2017, where the conversation amongst health professionals about climate and health wasn't as pervasive as it is now. So we really wanted to focus on that education level first. Next slide, please, Teddy. So this is just a screenshot actually of our Canadian page now. So since we have expanded to be inclusive of Canada, and the Nurses Climate Challenge has also been born in Europe. So when nurses register on nursesclimatechallenge.org, basically they are faced with now close to 24 resources about how climate change impacts their patients and communities, and tools to perform that education with their colleagues and their patients and folks within their whatever their practice setting is. So you can see that there we have a couple downloadable PowerPoint presentations. We have some resources for talking tips and strategies for tough conversations. We have resources for advocacy and how to get started as a sustainability champion in healthcare. Resources that pair nicely with the chant for how to communicate with elected officials, etc. So the goal is to arm nurses with resources that help them have these conversations and feel more comfortable about being messengers about how health is impacted by climate. Next slide, please. So as of currently, we have over 1,500 nurses across the globe, most are in the United States, that are nurse climate champions. And these nurses collectively have educated, now we just ticked up over 19,000 health professional colleagues, health professional students, nursing students across the country. And we also have 30 countries outside of the US that are participating. So we know that this is a global problem, and clearly nurses across the country, across the world, are starting to build these grassroots initiatives as well. Next slide, please. So this gives you an idea of actually just one slide within, I call it our bread and butter kit. So this shows how in the United States, healthcare contributes to climate change. And the gray clouds also give an idea of from a typical tertiary acute care health delivery system, a hospital. Where are the greenhouse gas emissions? How does a hospital contribute to climate change? And so we try to draw those lines to really connect. The largest portion of nursing in practice is within the hospital, but by no means is that all. And so as Beth went through the nursing sensitive environmental indicators, this is another way for nurses to get an idea of how their practice actually contributes to greenhouse gas emissions. This is also applicable, within community settings. Just imagine a different image. And thus, if their practice actually affects the climate and planetary health, how can their actions be adjusted to decrease their own profession's impact? Next slide, please. Thank you, Teddy. So this gives an idea of just a few of our highlighted nurse climate champions. And so each quarter, we like to really call attention to some terrific nurses doing work, just like Beth's podcast. So we have highlighted nurses in hospitals, nurse educators, community health nurses, school nurses, nurse advocates. And if you're curious about learning more about some of these folks, we have close to 20 profiles published now. So investigate a little more, and here's that inspirational piece. Next slide, please, Teddy. The other spin-off that has been born of the Nurses Climate Challenge is called the School of Nursing Commitment. And this is an initiative that was really co-developed by subject matter experts or faculty across the country who were working at the intersection of environmental health, nursing, and of course, climate change. And so this School of Nursing Commitment was developed as a tool for nursing schools across the country. At present, we're limited to the United States just in terms of capacity. But this is basically a tool where faculty are using those same resources to educate their nursing students directly and we're building a community of practice. So let's take a look at the next slide here. We have close to 30 School of Nursing partners across the country, and these range from very small state nursing schools with just a few hundred students up to very large academic medical centers with interdisciplinary health professional education. And so you may recognize some partner schools on here, of course, the University of Minnesota and the University of Wisconsin-Madison. But if you are a faculty member and are interested in having ready-made tools that are being used by dozens of faculty across the country and being part of that community of practice, I'd be very interested in talking more with you about what this can look like. Next slide, please. And as I mentioned, we are really working to grow these efforts outside of the US. And we went through a process in including the Canadian Alliance of Nurses for the Environment in this effort. So, while we might think that in the United States, the same climate impacts just north of us, not necessarily. And we also know that the cultural and practical application of climate and health content looks different in each nation. And so regardless of where you're coming from, thinking about the same science, thinking about the same educational science that's culturally applicable to your nursing students and just to nurses in practice generally, it's very possible to tailor what you're delivering to your communities. Next slide, please. I think I'm getting close to the end here. As I shared, this is also spreading into Europe now. So they are building their own School of Nursing partnership. This is in collaboration, again, with Annie and then Healthcare Without Harm Europe. So we're starting to see momentum and faculty glom onto this there as well. And final slide, please, Teddy. So it's just part of our communication and our sharing techniques. We encourage you to check out how to submit a selfie video for the Nurses Climate Challenge and how to talk about what you are doing in your education, in your practice, in your community to have an impact on climate change. So thank you so much for the opportunity to share about this campaign. I'll drop a couple links in the chat. And I think from here, Teddy, I hand it back to you.
Yes, thank you so much, Shanda. Some of you might have realized that we're following the REAP process here. We're discussing research, education, advocacy practice. Our second person who's speaking about education will be Jessica Leclaire.
Thanks so much, Teddy, and thanks, Shanda. We can go to the next slide, please. So I'm just so happy to share how I'm incorporating planetary health into curricula at the University of Wisconsin-Madison School of Nursing. I already shared what kept me up at night and why I'm doing this work. So to continue the story, in 2018, I joined academia from my public health nursing practice to educate our future nursing workforce about planetary health issues, including climate change and how nurses can address these public health threats. Now, because planetary health is an emerging field, I've also committed myself to conducting research on effective environmental justice nursing strategies that promote planetary health. So I'm also completing my second year in the PhD nursing program, and my goal is for our future nursing workforce to feel empowered to address these often very complex issues. Next slide, please. So I teach in the traditional BSN, the accelerated BSN, and the Doctor of Nursing Practice programs, in addition to being a PhD student. So I'm just involved in everything, it seems. I also have an affiliated appointment with the Nelson Institute for Environmental Studies. And today I only have time to share a couple of exemplars. So I'll start with my work in the traditional BSN program with those students. And I introduced planetary health in a class called Social Justice in Local and Global Settings. And I asked one of my former students in that class, Maria, to join me today. And in a little bit, she'll share something about her experience after I describe what we did. So we'll go on to the next slide, please. So these are just a couple images from our website to hopefully give you an idea of what active learning looks like at our school when we are not in the midst of a pandemic. We feel very fortunate to have these spaces to effectively engage very large groups of students. And our School of Nursing moved away from solely lecture-based classrooms to more of an active learning approach. So I provide a lot of background reading and resources for the students about planetary health and climate justice and the role of nurses to prepare for our in-class activity. I also want to mention that our School of Nursing has adopted a concept-based curriculum, which is an approach that moves away from subject-specific content and instead emphasizes these really big ideas that span multiple subject areas. We can then tie in exemplars to demonstrate how the concept can be applied to multiple issues. So for this class, our concept of the day was a social ecological model, which, as I'm sure you know, is a model that looks at strategies at the individual, family, community, systems, and policy levels. And the exemplar was about planetary health and climate justice. So in essence, we use the social ecological model as an approach to understand and implement the nursing strategies that address the human health effects of our planetary health problems and to promote solutions. Next slide, please. So this year we had a lot more asynchronous time than normal, as I'm sure you can appreciate. And so to help prepare for their synchronous activity, the students had a very deep critical dialogue in small online discussion groups that was just so impressive and inspiring to witness. Here are some of the questions that I used that week. They could decide to address either resilience or mitigation strategies and then choose a leadership question to respond to. And as you can see, I also incorporated intersectional environmentalism into our lesson plan. And that advocates for both the protection of people and the planet. So identifies the ways in which injustices happen, injustices that are happening to marginalized communities and to the earth are interconnected. Next slide, please. So in addition to the asynchronous lecture and readings and discussion on planetary health and climate justice, in our synchronous class session, I provided a brief lecture on communication strategies for health professionals related to planetary health and climate justice. And this is the outline for our synchronous activity. So they basically had to put together a pitch for bringing the Nurses Climate Challenge that Shanda just explained earlier to their current clinical site and or to their future place of work as a nurse. And so now I just would love to invite Maria, who was one of my students in this class, to share a little bit about what that experience was like learning about planetary health in this class. Thanks so much, Maria.
Hi, yes, so I'm Maria, and I was one of the lucky students who took this course with Jessica last semester at the University of Wisconsin-Madison, and I cannot emphasize how much I love this course. From a nursing student perspective, the content we learned really stood out to me compared to the rest of my curriculum in all of nursing school, and it was just so refreshing to learn about topics that are so relevant and applicable to nursing in today's environmental and social climate. And the planetary health and climate justice content of this course gave me the skills to critically think about the issues that are currently affecting our planet's health, furthermore tying it into the effects on planetary health and human health, which taught me what I can do as a nurse for climate justice. I found out about many amazing organizations and movements through this course, including the Alliance of Nurses for Healthy Environments, for which I'm now part of the 2021 student committee. And it's been so rewarding and fun to apply my newly found knowledge and interest in planetary health and nursing, and I have just absolutely loved being able to continue to learn and grow in this area of nursing. So I can say with full confidence that it's super important to include this content in nursing curricula, because this is a huge way that we can spread awareness and involvement of future nurses. So I'm personally so happy to be involved with this organization and mission, and I know it's something I want to be professionally involved with for the rest of my nursing career.
Thank you so much, Maria, for sharing your experience. And you and all of the students just constantly inspire me. And I also love keeping in touch with you throughout your future nursing career. So thank you so much. We'll go to the next slide, please. So I just want to briefly share one example of graduate curricula. So here are the learning outcomes for a new interdisciplinary graduate level course that I'm launching this summer, where students will explore the intersections between the risks to planetary health and the resulting impacts on communities using the lenses of healthcare, population health, social and environmental justice. Next slide, please. So as we've mentioned, these days, there are just endless opportunities to further the movement for planetary health and nursing education, and that really keeps me up at night in a very good way. I'll just leave you with some of my questions and ideas about how we could permanently more integrate and sustain the concept of planetary health into our nursing curricula. Clearly, we need to have comprehensive curricular goals, objectives, and infusion across courses and programs. Might there be a planetary health concept in undergraduate curricula for those of us who have concept-based curricula? How can we consider adding planetary health to our course objectives to really make sure that it's baked in from courses from semester to semester? What other opportunities might there be for graduate level courses? How can we support interdisciplinary, interprofessional education in planetary health? Might we imagine developing a minor or a certificate in planetary health nursing? Could we create postdoc opportunities to integrate planetary health into nursing research? Next slide, please. And I just wanted to leave you with some of my top planetary health education resources. We've all mentioned the Alliance of Nurses for Healthy Environments. They have an education work group that has been working very hard on creating not only environmental health and climate change curricula, also for their traditional BSN classes, as well as concept-based curriculum. So I invite you to go there and check out a lot of resources there for integrating it into nursing curricula. We've already touched a lot on the Nurses Climate Challenge and the Nurses Climate Challenge Schools of Nursing Commitment. I just want to lift up those wonderful resources again. And then one of my new favorites is the Planetary Health Alliance education site. There you'll find a lot of resources to develop your own curricula around planetary health. There's even an Introduction to Planetary Health 101 Google slide deck with notes that anyone can download and use that's kept up to date on a regular basis. So that's all for me. And thank you so much for your close attention. And I will pass it back to Teddy. Thank you.
Jess and Maria, thank you so much. We might start sleeping more soundly with such wonderful future nurses working in this field. Thank you. Our next speaker is Katie Huffling.
Teddy, I'm very excited to talk to all of you about advocacy, and I hope that these different presentations that you're hearing today, you're inspired to become amazing nurse advocates. Next slide, Teddy. So I want to start out just having you think about what your story is. As nurses, we see so many amazing, powerful things in our jobs. We're at people in their most intimate moments, and we can see personally the impacts of climate change and planetary health issues and how they're impacting the people that we care for in our communities. And as part of our nurses training, we are taught how to be really excellent educators. We can take complex scientific information and break it down into ways that the public can understand. And so by combining this incredibly powerful storytelling with our ability to relay this evidence-based information, it's a really powerful combination in advocacy. This is a photo of me and Charlotte Brody a couple years ago, where we were arrested in Washington, D.C., protesting in support of strong climate action. And we felt like it was our moral responsibility as nurses to join other protesters. I'm not advocating this for anyone else, but just, it was a powerful story that I can use now when I speak with elected officials, talking about why it was so important for me to be engaged in that type of peaceful protest. Next slide. So why nurses and advocacy? It's part of core nursing practice. When we look at our scope and standards of practice, it's woven throughout the whole document. So, just as we're advocates for our patients at the bedside, advocating for them in our communities within the political realm, it's just an extension of that type of advocacy. Next slide. And for the most trusted profession, the only time that we have not been the most trusted profession by the Gallup poll was after 9/11, when firefighters, of course, became number one, but we quickly took that back. And having such a trusted voice, our legislators and other elected officials, when we talk as a nursing profession, they definitely listen. Next slide. And there's so many ways that we can be engaged in advocacy. One of the best ways is to meet with your elected officials. Remember, they work for you. So whether it's your city council person, a state or federal legislative person, for those folks outside the US, depending on what your governmental system is, I would say, call them up, talk about how you're a nurse and these are the issues that are important to you. And, right now with the pandemic, it's actually one of the easiest times to meet with your elected officials or their staff person, because we can just easily jump on Zoom. One thing that I would recommend, when you do talk to them, is ask them, do they have a friend or family member that's a nurse? And in all my visits with elected officials, with nurses, like I've been taking them on Capitol Hill for years. It's very rare that they don't have a friend or family member that's a nurse. And it's just such a wonderful icebreaker. You're immediately a trusted voice. Next slide. Another couple great ways that you can get the nursing perspective out there. The first is the opinion editorial or op-ed. And elected officials really read the local newspapers, and they're very sensitive to any positive or negative opinions in these papers. And the opinion pages are the highest read pieces of the newspaper. So they really do make a difference, even though readership globally in newspapers has gone down over the past few years. Op-eds are usually 500 to 600 words. And talking about the things that you're seeing as a nurse around planetary health. If you've seen a piece in the newspaper talking about an issue that you care about, writing one of these op-eds can be incredibly powerful and help make policymakers sit up and listen. Next slide. And then if you want to start a little bit smaller scale, letters to the editor are similar to an op-ed, but they're shorter, usually 200, 250 words. And if you do submit a letter to the editor, it's in response to an article that was published in the newspaper. And you want to make sure that you're submitting it in a very timely fashion. So within a day or two of that article. And with both an op-ed and a letter to the editor, you really want to make sure that you're saying that you're a nurse and here is why you have this opinion. And here is some scientific information about it, or here are some things that you've experienced in your practice. Next slide. And now I just have a few examples of how nurses have engaged in advocacy and really brought the nursing voice to the table. The first I wanted to tell you about is Charlotte Wallace. She is the woman who is second from the right. She's a pediatric nurse who's worked in the environmental health realm for many years. And the US Environmental Protection Agency, this was during the Obama administration, had contacted me and asked me if I had a pediatric nurse who would like to meet with the EPA administrator. And I was like, oh, Charlotte would be great. She's perfect to talk with her. And then they started asking me for more information, like, what's her social security number? We need all this information. And then it clearly became apparent that it was a much bigger meeting and that she was going to be meeting with President Obama to talk about climate change and asthma. And one of the best moments, I guess, of the meeting was there were a number of physicians. She was the only nurse at the table. They'd kind of been talking over one another. And at one point, Obama stopped. He's like, wait. He's like, I want to hear what the nurse has to say. He's like, people don't listen to the doctors. They listen to their nurses. So, and she was able to provide a really powerful context of what it's like for lower income African-American moms in Baltimore, Maryland, whose babies are during their pregnancies are exposed to higher levels of air pollution and can have resultant high levels of asthma. And it was a really powerful moment for the voice of nurses. Next slide. This is Adelita Cantu. She's a nurse faculty at the University of Texas in San Antonio. And she's been part of a really great program educating elementary school age and junior high school aged children around environmental health and how it impacts, and especially air pollution, how it impacts their health and the health of their families. And so these young women are with her as part of this after school program. They all went and spoke to their city council and provided brief pieces on why addressing climate change was important to their health and the health of their families. Next slide. This is Samantha Parody. She's a nurse from Maine who became really engaged around planetary health because of the health impacts she was seeing in her community related to air pollution and the elevated temperatures that they're seeing in Maine. And she was so inspired that she ran for mayor in her town and she won. And she was able to, during her time as mayor, she was able to transition the town to 100% renewable energy. So, if any of you are politically inclined, running for local government is a great way for nurses to be involved in advocacy. Next slide. And then my last example here is Kara Cook. She's the nurse on the left-hand side here of the photo. And my organization was part of a coalition here in Maryland several years ago, working to keep fracking, which is a highly toxic form of oil and gas development, trying to keep it out of Maryland. And our health coalition was a really important voice in educating our legislators about all of the health issues related to that form of fossil fuel extraction. And we were actually able to have a fracking ban in Maryland. And it was, being a part of that type of advocacy was critical in getting that change to happen. Thank you.
Thank you so much, Katie. It's very inspiring and heartening to see what nurses can do when they put their action, their bodies and their minds and their words into action. And now we move towards Oriana Badet.
Hi, everyone. Good afternoon and welcome. I'm very happy to be joining you here today to be talking about planetary health and innovation and really celebrating the planetary health focus of the nurse innovators who I've been lucky enough to present with today. My name is Oriana Badet. I go by Ori for short, and I'm the VP of Innovation at the American Nurses Association. And I really appreciate the Planetary Health Alliance for inviting us to join their event today. Next slide, please. So when we think about health and next slide, please. When we think about health and the work that nurses are doing, we are essentially trying to harness the power of our profession. And one of the gifts of our profession is the ability to bring people together. It's to recognize what those gaps are and to close them. Very often, there are decisions that define our practice in the communities that we serve. And those decisions are made without the voice of nurses being at the table, their knowledge or their wisdom. And the vacuum of nursing's presence is putting our profession and people across our country at risk. As nurses, we have to step forward to choose a new path, and nursing has the strength to ensure that there is equitable health outcomes across our society. And this is why in the position in innovation, really working to live into the vision of our organization, which is a healthier world through the power of nursing by building a more robust process for the development and growth of nursing innovation. Next slide, please. Innovation is also one of our values as an organization. Next slide. And it is specifically called out in our strategic plan. Next slide. And innovation is also a part of the broader strategic work that we're doing as we look at transforming health and healthcare. We'll be working to build out a much more robust process for the development and growth of nurse innovators across our work. And ultimately, we want to advance the profession and expand the perceptions and build new capacity and innovation roles for the nursing profession within the frame of nursing improving health. And our healthcare system and health are already disrupted. When we look at all of the complex host of factors that many of us are aware of, it's my belief that nurses are perfectly poised to interrupt this disrupted system and to return health to people and communities nationally and globally. And we have heard that through the beautiful presentations of the nurses who have already presented. Next slide. So one of the things that we're doing, because we are changing the work of innovation across the American Nurses Association, we've relaunched a new innovation website. So if you have a chance, please go ahead and check it out. Next slide. And there are 4.2 million nurses in the United States with the potential and power to transform, positive change across healthcare and across our country, nationally and globally. Next slide. The majority of Americans, are again rating us just this year as the most honest and ethical profession. Next slide. And they also believe that nurses are the best profession to actually lead healthcare reform and transformation. Next slide. So one of the bodies of work that we had led over the last year was reinvigorating and relaunching our Innovation Advisory Board. We have a very strong and progressive group of leaders, and really looking again at the body of work that we're leading as a professional organization. Where are we going? What do we need to explore? How do we need to pivot and position ourselves moving forward? And together with the board, really working at expanding the role of innovation. Innovation needs to make sense to all nurses, that individual nurse who's working maybe at a critical access hospital, and also, how do we leverage the breadth of our organization as a professional organization to really impact broader policy. And, nurses are doing this across the continuum of care. So with this, very excited to say that and share the news that we have launched, we have an open call right now for the ANA Innovation Committees, and one of those is specifically focused on planetary and global health. Next slide. So just recognizing that innovation is not a zero-sum game. There's no shortages of areas across healthcare to be transformed. Our goal is to grow our innovation communities, and we believe that in this space, when nurses lead, that everyone will win. Next slide. So please don't hesitate to reach out if you want to share any work that you're leading, or if you want to participate or have questions. And again, excited to see nurses in this space stepping in to address the needs nationally and globally to address the impacts of climate change and planetary health. So thank you.
Thank you so much, Oriana. One of the things that you'll learn this week as you go through the Planetary Health meeting is that a core pillar is that we are heading towards a great transition. The only thing that's going to really help us have a livable planet is for everything to be transformed. And nursing is way ahead of the game because we speak about innovation. We have systems of innovation. We have frameworks of innovation through our profession. So we are really going to be called on to be the leaders, which brings me to another action that is taking off globally, and it has involved many, many of the people you've already heard speak today. I'm just here to tell the story. The story begins in 2014 when I was at the People's Climate March in New York City, 500,000 people preparing to send a very strong message to the US leaders that we needed to actively be involved in addressing greenhouse gases. When the march started, I didn't have white scrubs on or a white lab coat on or a stethoscope. I just carried this simple sign that said Minnesota Nurses for a Healthy Future. And what happened next it was just transformative in that people came off the curb. They were watching the march and they wanted to do selfies with me. And they said, the nurses are here. The nurses are here. I want to send a picture to my mom. I want to send a picture to my aunt. It was the most uncanny thing because it wasn't happening to anybody else around. And I certainly am not a famous person. So for people to want to address the nurses and say that they took great hope in that the nurses were present and addressing climate change just stuck with me. At the same time, I was beginning to follow the research of Project Drawdown, which is a comprehensive plan to draw down greenhouse gases. Absolutely fantastic evidence-based initiatives and activities. But you have to scale them. You have to get enough people doing them that it makes a difference. So I began to wonder, could it be possible for us to leverage the populations or the public's trust in nurses with the drawdown solutions to scale these solutions globally? And I never let a good idea just rest and not go forward. I contacted Project Drawdown people in California and said, have I got a deal for you? Let's see if we can work with nurses to promote the drawdown solutions. And fortunately, Project Drawdown thought it was a great idea, and Nurses Drawdown was born. Again, this is it was born and fulfilled thanks to many, many of our nursing leaders, not just in the United States, but around the globe. And the point is to inform nurses about drawdown solutions and how they can get involved. So we purposely chose 5 of the drawdown solutions, and we chose them based on their ability to provide co-benefits, advancing human health at the same time as helping the health of the planet. So our first area that we wanted to focus on was food. We are strongly urging nurses to encourage patients, communities, family members, neighbors, their own families to primarily eat a plant-based diet. We're also encouraging people who live in places where wood burning stoves are used quite significantly to, wherever possible, switch to clean burning cook stoves, and trying to tap into resources to make that possible. And then in nations where there's a lot of food available, to make sure that we do not waste food, because food that goes into just our garbage areas are a source of greenhouse gases. So we want to make sure that we are decreasing our food waste. We also want to get people moving. As you know, a sedentary lifestyle is one of the worst things that can take place for humans and can lead to all sorts of other illnesses. So we are having nurses promote bike infrastructure, walkable cities, and mass transit. We also are encouraging nurses around the world to support and promote educating girls and family planning. These 2 initiatives together, sometimes people always wonder the connection with greenhouse gases. When you educate girls, they have a profession and a way of earning income for their family, and they are able to make choices, reproductive health choices. And so it is actually a very, very powerful innovation or activity regarding greenhouse gases. Energy, we wanted to promote increased use of efficient energy for buildings, making our buildings efficient. And as you saw that slide that Shanda showed, many of our healthcare organizations are energy producers, and not in a good way. And we want to make sure that we're a force for encouraging our organizations to transition to clean energy sources. And finally, we're encouraging nature-based solutions. So planting trees and protecting tropical forests, protecting forests in non-tropical locations, and being involved to help people understand the co-benefits of nature. We know that stress is decreased when people have access to green spaces. There's more walking, so people are healthier. And there's many, many other human health benefits of protecting our planet's green spaces. So we hope that you will join us In Nurses Drawdown, you can, we'll put in the chat the Nurses Drawdown link, and then start promoting it. There are nursing organizations around the world, like the International Council of Nurses, Sigma Theta Tau International, who are involved in the planning of Nurses Drawdown and the promotion of Nurses Drawdown. So it's, feel free to get involved, send a selfie of you doing one of the drawdown activities, and join the movement. And now I'm going to turn it over to Oriana to tap all of you for where we go next as a profession.
All right, everyone. Thanks so much, Teddy. Again, phenomenal links in the chat. If you haven't had a chance to access those yet, the links have been shared. And if you have any questions, please feel free to pop those in the chat as well. But one of the things that we would love to do with all of you tonight is to invite you to be a part of next steps. You know, where do we go from here? And so we're going to do a short, you know, looking at time. Let's do a 2-minute reflection, and then I will be popping a link into the chat, so you're welcome to join us online on the Jamboard, or if you'd like to pop your reflections into the conversation in the chat. And also, you know, so look, what is your personal reflection from all of the incredible presentations that you saw today, or what is an action that you'd like to take next? And we'll open this up to conversation for the broader group. And so we'll start our 2 minutes now, and I will pop the link in the chat. So feel free to add those whenever you're ready. And Rachel and Maria, if you guys, and Lois, if you guys see any comments in the chat, are you willing to read those out for us, since I can't see those while sharing?
Sure thing.
Yes, yeah, we can do that.
Awesome, thanks everybody. And I'll move us to a clean screen so we can get us going, and I'll bring that slide over. Any ahas, anything that surprised you in the presentations, anything that you are interested in bringing forward? Or anything that you want to share with the group? This is your chance. And now a few of our speakers, and Teddy, I think you were one of them. You were lucky enough to be able to speak yesterday. I'm curious if you had any thoughts from your event last night.
I will talk about that. The Planetary Health Alliance has as one of its initiatives, Clinicians for Planetary Health. And this is not just nurses, this is nurses, physicians, respiratory therapists, social workers, dietitians, you name it, everybody who's involved in caring and providing care for patients. So if this is a group that you're interested in participating in, I would urge you to go to the Planetary Health Alliance and sign up. We have a link for Clinicians for Planetary Health. Sign up to receive the newsletter, and you will be invited to attend community actions and receive alerts about initiatives that are started.
So comment up on the board looking at the interconnectedness of the work. And I think the stories were phenomenal. Comment on the board about Teddy's 2014 climate march and the response to nurses from the general public, hearing that nurses were in the space. And the global effort that we're seeing of nurses. What about from our speakers? Any thoughts from our speakers around ahas? I know this is a tight-knit community. There are a lot of nurses who are doing work in this space. Any ahas from our speakers? Well, there's a great one. Bringing nurse drawdown to Nurses of Color Salon. Bring more BIPOC nurses into the conversation. Accessing the resources and PowerPoints. I know as soon as we heard that there were free resources, I thought that was and PowerPoints that were kept up to date. I thought that was phenomenal. How do we engage the voices of school nurses?
This is Jessica. Yeah, I've just been really struck from my conversations in the small group, and then also just seeing some of these chats posted, the breadth and depth of nurses on this call and the full scope of our experience. And I had some requests through private chat to reach out and to connect, after this, and I would love that. So I would love to keep the conversation going, and this is a movement, and so I'm just so thankful for everyone that's here joining us today. Thank you.
And we have a great, a lot of diversity in the people who signed up to attend. Anything that we need to hear about or that you want to put on our radar, you want us to follow up on? Part of the Child Health Planetary Health Group, upcoming conference. Jessica, have other schools reached out to you about your curriculum and your approach?
Not necessarily. I guess not reaching out specifically directly from people that I don't know. I welcome that after today. But again, the Nurses Climate Challenge School of Nursing Commitment, that's a wonderful network to kind of meet and greet, instructors from other schools and leaders of other schools, and just to kind of brainstorm sort of like this. We have breakout groups and so on with how we're being innovative with these different concepts and how we're getting it done. And so again, I thank you. I really encourage you to please do reach out and join the Nurses Climate Challenge School of Nursing Commitment, because that's just another wonderful group to get engaged with.
Well, and once you educate all of those nurses, I think, looking at how Beth has implemented and putting the framework in place for research around this work, and being able to put numbers and data to the story, how critical that is.
Ori, if I stop my share, are you able to pull up your the board, Jamboard, so people can see that?
Let me make sure everybody can see it. Let me know if that came through on your end.
Perfect.
Okay. So lots of requests to connect around some of those curriculum pieces. Teddy, you're also sharing some news early tomorrow morning. Do you want to share that with the group too, in case they want to attend?
Absolutely. I would be delighted to have people attend. It's quite early tomorrow morning, 8:15 Eastern time. And then as you go west, it gets even more earlier. But it is the release of the framework to guide planetary health education and core domains to embed into curriculum, and how to go about doing that. It is a global framework. We're hoping nurses around the world in higher education, faculty in higher education, not just in the field of nursing, but in all fields, will begin to embed these domains. We're very excited about it. It's going to be an open access piece, and it will be posted tomorrow. And once it's presented, one of the things we know in nursing, at least in the United States, is we are in the midst, or going to be starting shortly, redesigning curriculum based on the new essentials. So it's a perfect time for schools around the nation to start embedding the planetary health core domains into their work. People don't like to shift things if they don't have to, but we have to, so we might as well use this golden opportunity to bring planetary health, sustainability, and justice, as Jess said, forward. So hope you're able to attend tomorrow. If not, somebody asked about slide decks. We will be assembling a list of resources, and I can send those to everybody who registered for this event. If you did not register and popped in, I don't know, via a friend's link, feel free to email me. I put that in the chat space, and I'll make sure that you get a copy of resources that we wish to share with you. Thank you.
Yeah, absolutely. And I think, so we have curriculum interest, and I think part of it too is even thinking about how that curriculum can be applied by healthcare organizations. And what could that look like for continuing education as organizations are potentially looking at some of the impact? Shanda, any thoughts from you in that space, or Beth?
Yeah, terrific suggestion, Ori. I did drop just the General Nurses Climate Challenge email into the chat. And I think so many, especially clinical faculty, are both educating and practicing. So there's that natural connection between, universities and clinical space. There's also an increased interest for students in clinical settings to be working on sustainability or climate initiatives, especially some of those DNP students with DNP projects. So I'd love to talk more with faculty and students who are interested in that.
This is Beth. I would add, I spoke with Penn State recently, a couple of weeks ago, and one of the things that came up was if a university is taking a lead on learning about environmental stewardship in healthcare, they have a real opportunity to ask their clinical sites to kind of come up to speed. So that's another way that we can do this in a back and forth fashion, that academic settings learn about this from their clinical sites, but also that they push their clinical sites. And then secondly, in terms of, again, practice, which is what I focus on, research in practice, there are so many questions to be answered. So I think of doctoral students a lot and thinking of research questions that they can do in either a PhD doing the basic science or in DNP doing the applied science. it's an endless list. And I invite anyone who's serious about working deeper into chant, for instance. We have a lot of unsolved and unanalyzed responses that would be very rich for a doctoral project. And there are many more. Thanks.
I did see a question. Somebody was saying they've taught global health for quite some time, and what's the connection between planetary health and global health? Absolutely keep teaching your global health courses, and absolutely keep teaching public health, and if you're doing eco health. It's just that the planetary health tent, have you as a way of thinking of it, allows space for all of these movements, in addition to people that previously might have felt disconnected from the discourse, such as communities of faith, or artists, or poets, or dancers, or historians, philosophers. It really broadens the whole field to include everyone being part of this great transition that needs to take place.
And Katie, you're doing a lot in that advocacy space. What do you think are the biggest things that would be helpful? You shared a lot of great examples, but any questions from the group around things that you're nervous about, excited about, want some advice from Katie in that advocacy space, or Katie, words of advice to the group?
I'd say, if, listening to Beth's presentation when she said that, 80% of nurses have never or very rarely talked with elected officials, I think that we have a lot of work to do in that area. And I would say, don't be nervous. You're an expert in health, you're an expert in nursing, and most elected officials, they are not experts in this area. And so you can become a really great resource for them. And I've seen nurses go meet with their first elected official, so nervous. And by the second or third appointment, oh my God, they're transformed. And it's really amazing. And you can become a resource for your elected officials and become the one that they reach out to when they have questions around planetary health. I think it's just a really amazing opportunity for nurses.
Well, Katie, and it makes me think about your relationship, with the professional organization. We as a professional organization, we're continually having different, administrative groups and legislative groups and federal agencies reach out to us. And, last year was able to tap on Katie's shoulder and include her in an opportunity. And but it's through those relationships and knowing who's interested. And so how important that advocacy component is, and we do a lot of work in that space. And how do we unite and bring the right voices to those conversations? It's super important.
And Ori, I think you bring up another really good point about becoming members of your professional organizations. There's strength in numbers, and depending on your nursing subspecialty, they may have a full-time lobbyist or an advocacy arm within your professional organization. And so you can let those folks know that this is something that you're interested in, would like to be active in within your professional organization, and they can help make some of those connections with elected officials.
Well, we're just about at our time. Oriana, thank you for guiding the conversation. If you can stop share, and I'll reshare here. Okay, great. So the message we want to leave with you is nurses are a trusted source. We do have wonderful ideas and we get things done. I remember when I was a hospice nurse, oftentimes patients and families would be told by our physician colleagues, there's nothing more we can do for you. And nurses always thought and always said, oh yes, there is. We can keep you comfortable and we can help you transition. Similarly, nurse midwives give those messages. We can help you transition. Nurses are experts at transition, and we are here to help people with the great transition. We know that there's going to be challenges, but we will be moving society forward towards a more sustainable, equitable model, and one where we work together in solidarity for the future of all people. Thank you for joining us today, and we will make sure that we send you resources in either later this week or the beginning of next week. Thank you very much.